remote care will become the way that most of the patients will get their care. It for sure will happen. The question, who will be the dominant companies that will do the best for the patients and for the providers and will be able to facilitate and to provide the best outcomes for the patients.
Welcome to the Growth Stack, the show where we explore how great companies grow smarter and faster through better technology and talent. Today, I'm joined by Tal Amitay, VP of Engineering at Brook Health. Brook pairs a modern data platform with clinical teams to help health systems support patients with chronic conditions. Tal, welcome to the show.
Thank you. Thank you for having me.
Of course. So I like to start these off with just sharing a little bit about your background and how you came to be the VP at Brook Health.
Okay. So my journey started in Israel, actually, where I grew up and went to university and started my career there. I started my career in the startup industry in Israel. I have the pleasure to work in few very successful startups and learned a lot there. I worked in a startup, traffic systems, that after some time acquired by, in these days, it was F5 Networks. I think they changed a little bit their name. And during this acquisition, I found myself like managing larger teams and grew up the team. And most of my focus in these days was around infrastructure, networking, security, more behind the scene work. When people ask me what I'm doing, it was very hard to explain what I'm doing.
Sure.
It's like, was very, very technical, moving packets from one side to another in scale. Through F5, I moved to the US to take role in the core product, in the flagship product of the company. Had the pleasure to work on evolving this product, building the next generation of this. And after some time, I decided to make a small shift, and then I moved and worked in Stripe, but still on the infrastructure and on the security side. This is the journey before Brook. Everything was around the 5 nines and to make sure that the systems are always, reliable. And this led me to thinking, if this is, how can I move to something that I feel, and I feel the customers, feel the consumers. And I decided to move to work in care, health tech. Mm-hmm. When I feel that, I see the value of what we are doing on a daily basis. This is how I find myself in Brook. So from focusing on the reliability of the system, now reliability is something a little bit different. Like, it's the life of our patients. This is the journey, from my early career to where I am right now. And just a few words about Brook. Brook AI is a startup in the health tech, like you said, focusing on remote care for chronic conditions. I believe we'll talk a little bit more about it later.
Yeah. So, and my understanding is Brook was it 8 years old?
Something like this. Brook started something like this, something like 8 years old. And it started, like many startups, it says like several iteration and, until the company actually find a good product market fit. The company started from chronic conditions, started from diabetes, started from the consumer experience there. The company changed a little bit to focus mostly on remote care. And this happened in the last few years. And this is something that I taking part in, to evolve the company to become the best remote care company.
So what are some of the chronic conditions that some of your patients have?
Yeah, it's a great question. So the company actually started from focusing on diabetes.
Okay.
And after this, it was extended to some other conditions like obesity and CHF, heart failures, high blood pressure, some of these conditions that in general, people need to learn how to live with these conditions and to manage their life with these conditions. And this is what we're trying to help them doing and supporting them through this process of learning how to manage and after this maintaining the condition.
So how does a patient get involved with Brook Health? Are they contacting you directly or is it some other way?
So the patients are not contact us directly. It's mostly coming with partnership with the clinic or with the healthcare system, the hospital, when the provider believes that this is the right treatment for the patient. So the patient referred by the providers. Sometimes it's directly, sometimes it's based on how the hospital is working. You know that all these patients with these conditions automatically moving to us. In general, it's closing the gap between what's happening in the visit of the patient in the clinic. Let's take example of someone with diabetes.
Hmm.
Someone with diabetes, George with diabetes, will visit the clinic probably every year. In some other
Okay.
cases, every 6 months. But what's happening in between? How the patient or the consumer is going to manage well the condition during this time? How the provider will know when to what's happening with the patient. So this is our solution, is closing this gap, closing the gap between what's happening in the visit. And we're extending the primary care. We're not replacing the primary care. We're working with the primary care to extend them and to give a holistic support to the patients 24 hours, 7 days a week. We are monitoring the patient all the time. And in this way, can give support and can optimizing the care based on what's actually happening with the patient.
And so with diabetes, I know people with diabetes or maybe even pre-diabetic might wear glucose monitors,
Yes.
and that is at least uploading data to your phone. So what is someone with some other condition? Are there other medical devices for some of these other conditions? Blood pressure, for example. Is
So
something
blood pressure.
uploading to your site, or how does that work?
Yeah, this is a great question. We are collecting a lot of data about the patients from devices. Devices can be, like you said, the glucose meter. Devices
Hmm.
can be the blood pressure cuff. Devices can be a scale. There are
Okay.
many devices. Each device is the right device for specific condition. What we are doing, we are connecting with this device. In many cases, it's a direct connections through cellular. In some other
Okay.
cases, it's connection through the phone. So with our app connecting to everything that's coming to the phone, all the medical information, of course, not everything, but all the
Right.
information like the glucose meter, the CGM, the continuous glucose meter that you talked about, or other devices. And in this way, moving the data from the device or from the phone of the patient to us, analyzing it. And in this way, we can learn much more about the patient and supporting the patient much better. So it's like, this is one way for us to get information about the patient. It's not the only way. There is a lot of other information coming directly from the patient in the conversation with us.
Mm.
There is
Okay.
also a lot of information coming from the medical record of the patient that we're integrating with. Today, when almost everyone are wearing, a smartwatch, or in my case, even a
Y-
ring,
Right.
those things are collecting a lot of information about my sleeping, for example.
Right.
My sleeping information, it's very important to our ability to manage the health and to manage the condition well. Your data about your sleeping with the data about the medication you're taking, with the data about the specific reading that with the blood pressure cuff, all those things together, building enough overview or like holistic understanding about the patients so we can use it to understand much better how to personalize the care, what need to be changed, what are the areas that the patients need a little bit more support, what are the areas that we need to maintain. Because sometimes you're doing enough exercise, you're sleeping well. We want
Right.
to maintain this. Always learning as a patient with chronic condition. You're always learning about what working well for you, what did not work well for you, what you should maintain, what you should change in your lifestyle. It's a
Mm.
lot about your lifestyle. This is where we are like coming into this because we see a very we're getting data from many sources. I don't think that there are many, solutions that getting data from so many different sources and we can build, a very good holistic view about the patient. And this is helping our system to provide a very personalized care to make sure that the care plans built correctly for the specific patient to change things sometimes. Sometimes we need to change medications. Of course, it's with discussion with the primary provider.
Right.
But the fact that we can identify those things in real time and can make those changes, this is pretty amazing. This is something that was not exist like a few years ago. It was a dream
Yeah.
few years ago when a provider could change something in your medication, only when you did the blood test in the clinic.
Yeah.
And now it can be much more dynamic and much more relevant to what you actually need in this moment.
Sorry for the quick interruption, but if you want to contact the guest, check the description for the best way to contact them. And if you are interested in hiring nearshore software development contractors, or you are interested in using AI to improve any function of your business, you can go to the link right here to set up a meeting to discuss your needs. Now back to the episode. Right. Going back to that diabetes patient, he sees his doctor once a year. I'm guessing they do another blood check at that point, 2 data points, 1 year, and then at the end of the beginning of the year, at the end of the year, there's not much data there. Does that doctor have access to this patient's information? Does the patient need to show it? How does the doctor and patient use your insights?
First, the answer is yes, the
Okay.
provider part of this. So this is the reason we are extending the primary care, working together with the providers. The provider can see the data on our platform. The provider are getting the data inside their EMR as
Okay.
part of the medical records of the
Yeah.
patient. The provider sometimes getting notification from our care team that something urgent need to happen with a specific patient. So it's not only checking something that happening every month, because this is happening, a report every month about the progress of the patient, this kind of things happening, but it's more dynamic than this. And our platform it's giving all these different sources of data, combine them together to give a very good overview and a very good understanding about what is actually happening with the patient.
Yeah, this is such a fascinating field to me because as I've gotten older, I'm into, exercise like triathlons and that sort of stuff, and family history of high cholesterol, and I'm more concerned. And if I were only looking at, the once a year physical from my doctor, there's so little data points to get valuable information. If I make a lifestyle change that lasts for, let's say, 3 months, and I want to see how that affects my cholesterol, I would have no way of knowing unless I do it right next to another doctor visit. So I've personally just paid for my own cholesterol test just so I have more data points. I could try something and see the results of it. What you guys are describing, or what you're describing about Brook Health, is really exciting for me, so that I could see this. And I love the technology. I have the Aura Ring, so I love these extra data points. Really fascinating. So transitioning to kind of, the technology side of things, you guys are using AI, right?
Of course,
You're an
a lot.
AI company, right? So can you talk a little bit more of how your use of AI and what's that doing for the patient?
Yeah, before I'm jumping to talk about the AI, like you said that you're worried and about these kind of conditions, and I must say that you should worry about them.
Yeah.
The statistics, I think that 50% of the populations have chronic conditions. I think that something like 80% above 65 have at least one chronic condition. With the shortage in doctors, in nurses, I think that 300,000 nurses are missing right now from the healthcare system. In the next 10 years, something like 80,000 doctors will be missing from the healthcare system. So this is connected directly to the AI and what AI will do for us. But with the situation right now in the healthcare systems, with the increase all the time of people with chronic condition, I think that the need for this kind of care is very obvious right now.
Yeah.
It's became very obvious. And with the shortage I just talked about, with the shortage of doctors and shortage of nurses, we need to find ways to be more sophisticated in what the humans are going to do and what the machines will do for us.
Okay.
And this is where the AI is coming, and the AI is helping us. The AI in our case is not to replace the nurses or the provider. The AI first, it's good to say something about the history of the company. So when the company started,
Yeah.
the first thing that the company built, that Brook built, was a bot for patients. But the
Okay.
bot was rule-based engine because this is the technology was there.
Yeah.
Pretty limited.
Yeah.
We all know that in the last, we were feeling this, like in the last few years, we are expecting much more from every bot we are talking with or
Right.
chat
Right.
with.
Yeah.
And we can actually get much more from every communication we have with any AI system. So the first is how we are giving the best experience for the patients. And the best experience, it's not only, very advanced answers. Best experience, it's that it's always will be right, because in healthcare, you can't do mistakes.
Yeah.
It needs to be very secure. You can't do mistakes also there in healthcare. So you're starting with many walls that you need to go above, with when you're thinking about AI, how to embed AI in healthcare. And on the same time, we're sitting on a giant mountain of data that this is always the questions with AI systems. Like AI systems can be very good based on the data that they have. So if they have a very good context, they can become very accurate and very sophisticated. If they don't have very good context, this is when they start to, give you answers that are not connected to anything. So for us, it's the experience of the patient, how the patient will be able to get support from our AI bot. And the reason for this, it's not to replace the humans. Like as someone that using this, like the ring or some other says, that what you actually want, you want something that will tell you what to tweak. You're not right now start a discussion about, the weather tomorrow. This is not
Right.
what you're trying to do in this situation. You want to understand where you are, what you need to change a little bit, what you need to maintain. This is the kind of interactions that you want to have with the AI system. So it's AI system that the experience is around giving a very accurate view that helping you to improve something. Sometimes you have not taken your medication and we need to notify you. We need to check. Sometimes you're not feeling very well after you took your medication, and we need to know this. Sometimes you use the device that we gave you. We are telling you, oh, great that you've been on this device. Maybe you can do also something else. Sometimes you want to understand what you're going to eat later or what exercise you're going to do. Okay.
Yeah.
Or sometimes something is not working on your device and you just need a simple support. There are so many different use cases, and we are trying to support all these many, many use cases. And in some cases, and this is the complicated part, we need to know when we actually need to escalate it to a human, when we need to escalate it to a nurse. So we always have a human in the loop. And this is what helping us to be, when I talked about a security and compliance and all these pieces that need to integrate as part of the AI, human in the loop is always there. But this is only half of the AI brain, in our company. The second part is what is happening on the care team side, how we are optimizing the care there, how we are notify only on what the nurses actually or the doctors should know about, how we are summarizing in the best way what is happening with the patients, how we are preparing the care expert for the discussion with the patient. And this is what the AI also helping us. AI, it's like a big name today, it's like AI, it's not only, it's a little bit wider than just the large language models. That of course taking a big part because they became so advanced. But this is how AI is becoming a critical piece of our solution. It's actually the brain, and everything is built around the AI brain that we built for the company.
At Brook, you have, I think, under 100 employees. Is that right?
Actually, more than 100.
Oh, more than 100.
We're closer to the 150 or something.
Oh, that's great. So if we were to look at your staff, what percentage is on the engineering side and building out and using more of this AI? And sounds like there's a big roadmap there. And then you have, I'm guessing, some medical advisors. I don't know if they're on staff or just advisors that you work with. And then you talked about this care team. Is that like the patient's normal doctor, or is that staff members that you guys have?
Yeah, it's a great question. So I will start with the care team actually. So the care
Okay.
team is part of Brook. We have
Okay.
a large care team that is part of Brook and giving like I said, it's the extension of the clinic. Think about it like, you have your provider, you have the few nurses or other staff, in the clinic.
Right.
Their challenge is always how they can give the best support to the population that they have, to their patients. And it's very hard for clinics to be able to do it because the number of people that need care is just going and going, like I said. So the
Yeah.
so the pressure on the clinics is always becoming higher and higher in the end. And they are looking for way, like for clinics to say, okay, we can come and give also the remote care. I'm not saying that there are no clinics or hospitals that trying this, but it's not working very well based on what we know. The way that we found that it's working very well, it works actually. The clinics and the hospitals, the care team is part of Brook, and many of the tools and a lot of the AI that we are building are solutions for these teams. It's not the only thing we are
Okay.
doing, but we are building the solutions and the tools for this team. The engineering team in Brook, we're something like, engineering products, something like 20% of the workforce. It's pretty small and pretty compact. And I think that with what happened in the last year and a half, we could optimize a lot in how we are working. We are continuing to grow, by the way. We are continuing to hiring for engineers and then product actively today. But what we can get from every engineer is much more than before. And we're using the most advanced tools to be able to get much more. And our engineers are, this is the typecast of what we're looking for, people that are very advanced in how they are like building AI, using AI, and on the same time, understanding healthcare good enough to be able to operate in a very challenging environment like healthcare.
Sure. So for those engineers, I've been in some environments where I built some software and we're talking about, I don't know, an expense report. You go on a trip, you gotta, put your receipts and say I spent $400 on my flights, for example. Super easy for anyone, for almost any adult to kind of get that concept. But when we're getting into healthcare, that's maybe not as easy to understand. So I guess you have some like product people that are telling the engineers what we're building, and they have to be a lot more knowledgeable in this field than maybe the
Yes.
engineers, but I guess the engineers over time become a wealth of knowledge as well.
Yes, and this is a great question. To understand exactly what you are building is like you said, it's a little bit more complicated in healthcare.
Yeah.
Sometimes you are like, all those things from the patient side. Sometimes if you
Yeah.
are a little bit closer to what's happening in the care teams, you know it from the other side. But there are so many other complexity in the industry, like for example, things around the billing and the insurance. And
Yeah.
it's not only, the care itself, the data exchange that as engineers, we are in the middle of this, we need to get data from the electronic record data from the clinic, and it's coming in different structure. It's very, there are many legacy systems. So the challenges very unique to healthcare. They are not only around if I understand all the details about a specific condition,
Mm,
because for this we have the experts.
sure.
It's around the complexity in general of the healthcare systems. And we are also understanding much better probably from the regular engineer, about diabetes or about CHF. Our engineers understand it much more in details than a regular engineer, of course, or a regular person that you can talk with in the street. But what I'm trying to say is that it's not only the care aspects. There are so many other aspects making it challenging in healthcare: compliance aspects, security aspects, data, all the legacy systems. One of the stories that I'm telling to friends that, we needed to complete an integration in the end, it's ended with, okay, we'll get a fax, we'll analyze the fax, and we'll edit. So it's still existing. It can happen in a much more advanced way from our side. We can get the facts, of course, analyzing it quickly, running AI on top of this. So there are many advanced things that we can do it, but the integration themselves are still, in some cases, it's not that there are most of the integration are very modern, but there are some legacy systems that you still need to work with. And this is
Yeah.
part of the challenge here.
And you guys are just in the US right now, is that right?
We are actually in US and Mexico.
In
Our
Mexico.
team is splitting between US and Mexico. The engineers are in the US. We're only actually in Bellevue. The rest of the company are also spread in the East Coast. But for engineering and product, it's Bellevue, Washington.
I guess I should have asked this question differently. The healthcare system is just the US healthcare system. The
Oh,
patients
yeah.
are just in the US?
Yes.
Because
We're focusing only on the US market right now.
I would imagine, like I said, going back to my example, you go on a business trip in the US, you go business trip in Europe, the expense report is basically the same.
Yeah.
But on healthcare, I know the US healthcare system is very complex. I've seen some videos on how some of this stuff works, and I get confused. But it's very different than in Europe, or I would imagine South America. So is there a plan to expand outside of the US for patients
Not in the
near future?
near future. This is one of the reasons not to expand like this, is
Yeah.
that it's different in every location and in every state, every country. But I think that the other reason for this is that this market just started in the US. It just started. Like remote care, it's not that everyone are using remote care right now. The business potential here is huge. And it's very clear that the market will move to this direction. It's not a question if remote care will become the way that most of the patients will get their care. For sure will happen. The question, who will be the dominant companies that will do the best work for the patients and for the providers and will be able to facilitate and to provide the best outcomes for the patients? This is the question, and this is where we are playing, and this is what we are trying to do, to be the best company that providing amazing outcomes, and we have amazing outcomes for our patients, and we see the improvements and the improvements in the care and the improvement in the objective results of the patients. We see the improvement. So we see that it's working. I think that as a technology company, the challenge is always how you are scaling it, how you're making it repeatable, how you're making it work in scale, how you're optimizing it to work in scale. What are the solutions you're using to do it? So this is where the challenges are, but this is what makes it so interesting. This is a startup. This is what makes startup so interesting.
So I was going to ask you about challenges. So yeah, doing things at scale. I remember watching some like doctors or medical researchers on YouTube talk about, when you're trying to bring a drug to market, something may work in a small clinical trial, works in a slightly bigger one, but when you do it at scale, maybe it doesn't work as well for whatever reasons. So this is probably no different than that, similar challenge. So what is your top challenge right now? I guess maybe you're on the engineering side. So from the engineering perspective, what challenge do you have?
Yeah, I think it's the one oversee holistically all the technology here. It's not only like how we're building products. It's the challenges are wider than just how we are building the product, but it's also existing there. I mentioned a little bit about the data interoperability and the challenges there. It's not going to disappear, this challenge. It's just going to grow as the expectations that every product we know everything about the patients, the data exchange is becoming much. It's not anymore a question if you should or something. You must doing it, and you must doing it well, and you must creating the cross correlation between the data points that you are getting. This is always going to be a challenge, especially in the healthcare systems that you are dealing with many legacy systems. EMR, EHR that was built, 10 years, 20 years ago that you need to integrate with, and on the same time to integrate with a very modern stack that a different clinic may have. So this is one challenge. I think that the other challenge is we talked a lot about the AI, but the adoption of the AI it's not automatic. Like it's need to fit to the workflow, to the clinician workflow. And we have our internal clinicians, so we know it, we learn about it very well. Like it's not enough to build a system that analyzing something and is very smart in finding anomalies or finding some other things and telling you things about the patients that, crossing data from different data sources and telling you what's happening with the patients, who is even the recommended treatment. This is not enough. It's need to fit to how the care teams and how the clinicians are working. And it's need to fit to how the providers in the clinics are working, to how our clinicians are working. This is going to be a challenge. So this is not going to disappear. I think the industry around us, the technology industry, is moving also so quickly. And for us, the challenge is as a startup is how can we move so quickly like the industry around us, to use the most advanced tools, all the agents that helping us to writing the best code. And on the same time, we have a, weight on our legs that not letting us to jump very high because of everything we need to do around security and compliance. So how we are doing it, how we are moving very fast when security and compliance are integrated and of what we are doing. For me, like when I'm saying when I'm talking about security and compliance, if I'm doing it correctly, it's actually let me to move faster. And I believe, by the way, that all the industry will be there in the future. It's not going to be only healthcare. The bar for what we expect from a system around security, around privacy is going higher and higher. And we are a little bit ahead of the curve there because of all the regulation in healthcare. I believe that the rest of the industry also will be there. So we, in this area, we moved a little bit faster. And this is why I think that it's going to be, for us, it's embedded inside our development cycles and inside how we are building solutions. But the challenge here is that in some areas, it's still not letting us to move so quickly. I will give a quick example. You want to use, for example, an agents to help building code. Not every agent we can use because it's not giving the same privacy that we're expecting. It's not meeting the regulations that we're expecting. So something like this that not even thinking about, they're just moving and moving and moving. For us, we all the time need to act like a very large company, but we are not very large. We are still a startup.
Right.
So this is, I think, one of the challenges. But like I said, I believe that it will become a challenge for everyone in the future.
That's exciting. Startups are, if you like that world, it's very exciting. And especially in this field, as you get a little bit of a chance to kind of dictate how you get to shape this field a little bit through what you're building. It's really fascinating. I could ask you a lot more questions. I'm super fascinated by it. But in the interest of time, do you have any final things, any takeaways, any tips that you have for anyone?
I think that what I said in the end, that thinking about many of the engineering teams around the world, thinking about the AI and how they're building AI, but taking the privacy, the security as a fair citizen inside the development cycle will help others to move fast. It feels like it's slowing, in some places, but without doing it correctly and without making it a fair citizen, in everything we're doing, it will slow people. And I believe that other industry will move and will suffer or will have the same challenges, let's say it like this. The other things, I think that a lot is going to happen in healthcare. And healthcare, it's one of the industries that will see a lot of growth in the future. So it's a great place for new startups and new ideas to start. And I really hope that we'll see more and more companies like us coming and building, and helping to make the healthcare industry much more modern and continue to improving it.
And I think what I thought about when you were saying that is it's not just growing a business, it's growing a business that could fundamentally help people's lives, their day-to-day lives, people with chronic conditions, that they're getting more data in their hands more quickly and can make better decisions on a day-to-day basis that improves their quality of life, which is so important. You realize as you get older, things aren't always guaranteed that you have, a healthy body and you can get out of bed without aches and pains.
Exactly.
And final thing, where, I guess, to get a hold of Brook Health, what's the website?
So it's Brook.ai, very simple.
Rook.ai. All right. Well,
And
Tal,
yeah,
it's been a pleasure chatting with you today. Like I said, we could probably talk a lot longer, but I really look forward to the future of Brook and seeing not only with chronic conditions, but like folks like myself that just want more data and want more analysis to improve my life. I really look forward to seeing what you guys can do. Thank you for joining me today.
thank you. It was fun. Thank you.
Thanks for watching. Make sure you like, subscribe, and click on the bell for notifications of upcoming episodes. If you want to contact the guest, check the description for the best way to contact them. But if you are interested in hiring nearshore software development contractors, or you are interested in using AI to improve any function of your business, you can go to the link right here to set up a meeting to discuss your needs.